Hi, my name is Jim. I'm going to be your nurse today. Can I have your full name and date of birth? Jenny Lee, June 9, 1960. How are you today, Miss Lee? Oh, you're doing well. Have you had a good sleep last night? Oh, you have? Glad to hear that. Can I take a look at your wristband? Everything match? I'm here today to do your CVAC dressing procedure. This is stand for Central Venous Access Device. You have it. Go to your chest, go to the vein, and toward to the heart. It will give you nutrition, medication, and fluid. And the dressing that go on the top of it will be changed every 7 days to prevent any infection. We don't need an order for this procedure because it's a hospital policy. Do you have you had this procedure done before? You have? Okay, that's great. Hopefully it will go really smoothly. Do you have any allergy like chlorhexidine, tape, or latex? No allergy. That's great. Are you feel any pain today, Miss Lee? No pain? Okay, wonderful. And this is for the procedure. I'm going to have you wear a mask and turn your head to the side that prevent any possible sneezing, coughing, which can be germ on the top of it. It's both sides and the dressing as well. I also wear my mask. Can I put on your mask right now? 20-second hand hygiene. Do you have any question or concern so far, Miss Lee? No question, no concern. That's right. Continue with the procedure. I'm gonna to be remove your old dressing and set aside the tubing and clean up the area. Put on a new pile pads and new dressing. Do you have any question or concern about the procedure? No? Okay, that's right. 20-second hand hygiene. I'm gonna start to clean up the side, the workplace for 30 seconds and let it dry in 2 minutes. Do you have any visitor today? You have? Who came to visit you? Oh, your sister. Does she travel from afar or is she local? Oh, she from LA. Okay. What do you like to do with her when you travel there? Oh, you like food? Oh, that's great. Me too. There's a lot of great food there. I'm glad to hear that you have your family around to support you. It's really lonely to be in the hospital. 20-second hand hygiene and let it dry 2 minutes. And it in 2 minutes I get my supply here. Put everything down. The biopack, the sofa view, and I open the supply. I have the sterilized glove. I open the biopack too. In the second hand hygiene, can I turn your head to the side to prevent any sneezing or coughing infection to the side? Are you comfortable? You good? Thank you. Now I close the curtain for privacy. 20-second hand hygiene. I pull down the gown to look at the side. 20-second hand hygiene. Now I'm saw the dressing still dry and intact. The cutter on the right side of the shoulder and toward to the right shoulder. I'm seeing that the gland is 20 centimeters as previously documented. I'm going to remove the process now. It may feel like pulling and tucking, but it shouldn't be pain. Alright, I'm going to be story. How are you doing so far, Miss Lee? You good? Any pain? Any discomfort? You good? I'm pulling the dressing off and I see that there's no sign of infection, no redness, no swelling, no draining. The tubing is still intact, no leaking. Are you okay? The bile pack may be stuck here. Are you okay? Any pain so far? 22nd hand hygiene. I see that the tube is still intact, no leaking, no rot, and it's still clamped to prevent any air embolism, but I didn't tell this for the patient. I'm going to accept the measure is 20 centimeters. And we do that because to make sure the catheter hasn't moved during the process. 22nd hand hygiene. I'm gonna wear the sterile glove. I roll in the cup. Make sure the cup is good. Now I cleaning the side. One, two, three, in 30 seconds. And I let it dry in 30 seconds. Now I put the bio pad on. I will take it like taco. And put on the ground. The dressing on. And make sure to make a dress look. I keep this. Let me put on the pen. Put the tape on. You're almost done. Are you doing okay? Are you good to hear that? And I'm gonna initial that day, time, to 28 by me at 12, and that's all. I'm gonna take off the glove, 20-second hand hygiene, and then I put on a new glove. The last thing, I change the cap. I open the cap. I shoot the book in 15 seconds. And let it dry in 5 seconds. And then put on a new cap. And I clean up the side. And put in the proper receptacle. And then I take off the glove. 20-second hand hygiene. Alright, can I turn your head back and remove your mask? And remove your gauze. 20-second hand hygiene. How the residue doing? Oh, it's doing well, awesome. Do you have any pain or discomfort throughout it? No pain, no discomfort. Okay, great. And do you have any question and concern for me this time? No question, no concern. So before I play, I just want to document that I did change the dressing, and today is 2/28 at noon at 12 by me. When I did I set aside, I saw no sign of infection, no redness, no swelling, no changing, and the tubing were intact with no leaking, no rack, and the lamp was secure, and cutter is measured about 20 centimeter at the same variously documented, and it's still sitting on the right shoulder facing the right shoulder too. And you also tolerated this procedure with 0 out of 10, 0 out of 10 pain. And before I go, leaving alone in your bed and put on the roll up and put the cord line in your wrist. And please feel free to press the button if you need anything. I hope you have a wonderful day. Miss Lee, 22nd hand hygiene.